Aloha and welcome. My name is Dr. Hanale. I'm the founder and executive community director for the Energetic Health Institute, and it is my duty in this video to inform you that the views and actions expressed in this video are not indicative and do not reflect the views of the Energetic Health Institute, and that the Energetic Health Institute is taking a neutral, completely neutral stance on this. This is my video alone, and the EHI is being so kind as to allow me to have a platform to speak to you today. I want to share with you three things today. One is a research paper that a team of volunteers that I've been working on, professionals and healthcare professionals, legal professionals, all volunteering their time and their expertise, have authored. It has been peer reviewed. It has been published in the IPAC, a Journal in Public Health Policy Initiative Journal. As of yesterday, we're very excited about it, very proud of the work we've done. It was a labor of about 3 months of research that we put into this paper, making sure and verifying that everything that I'm about to share with you is accurate to the best of our ability. There are some very serious allegations in this paper that are made, and we are calling on, and I say we, another organization that I'm working with, volunteer group again, is calling on a formal grand jury investigation of these matters, calling on the Department of Justice and U.S. attorneys to embark upon and launch a full, transparent, thorough grand jury investigation into these matters. I will let you know that the other organization that I am working with, Operation Phoenix Rising, has sent out over 250 priority mail physical copies of the paper, the formal grand jury petition, and supporting exhibit documentation to every U.S. attorney and to the Department of Justice, and that we need your help. We need your help to file complaints to the Department of Justice, to strongly and hopefully politely and respectfully encourage them, demand of them respectfully that they uphold their oath to the American people, to our Constitution, and to make sure that justice is served in this case, because we feel like we've found something very significant, and it deserves investigation at the very least. So I want to read to you today the press release that we have and show you how you can access the paper, and also show you how that you can take action and make your voice heard if you agree with the findings in the paper. All right, and of course, we encourage you to share this information with as many people as you can if you agree with the findings. And even if you disagree, share it as well. But let's get a conversation started, because that's something that we desperately need to take place on the topic of this magnitude and what we've unearthed. So first thing I want to do is I want to share with you our statement here, our press release statement. This is the cover letter that has gone out to every U.S. attorney and to members of the Department of Justice, appropriate members. We've done, I think, a really good job of identifying all of our U.S. attorneys, their aides, and the Department of Justice and their aides, and making sure that we're getting a physical copy of this in their hands. We are also going to be following up and sending digital electronic copies to all the emails that we have access to, and we don't have an email, unfortunately, for everyone in our justice departments. New research, so COVID-19 data, CDC violated federal law to inflate cases and fatalities, something that we've been suspicious of, I think most of us, for much of this year. Our findings support this statement, and we understand the salacious nature of this statement. The CDC goes rogue, millions of Americans suffer as a result. We stand by that statement. New research published this week alleges that the Centers for Disease Control and Prevention, the CDC, willfully violated multiple federal laws regarding COVID-19 case and fatality data. In doing so, the research alleges that the CDC intentionally acted to defraud the United States, her elected officials, and her citizens. Published on October 12th in the peer-reviewed journal Institute for Pure and Applied Knowledge, IPAC, within their Public Health Policy Initiative Division, The research paper asserts that the CDC willfully violated multiple federal laws, including the Information Quality Act, the Paperwork Reduction Act, and the Administrative Procedures Act at minimum. You can read about these in this document here, and you can read more about the Administrative Procedures Act in our formal petition. We will make that available to you in the coming days. Our formal grand jury petition. Most notable in the author's findings is that the CDC adopted two key documents creating new rules for data collection and reporting exclusively for COVID-19. The authors demonstrate that the CDC failed to apply for mandatory federal oversight or open a mandatory period for public scientific comment essential for ensuring transparency in government. As a result, the authors assert that the CDC willfully compromised the accuracy and integrity of all COVID-19 case and fatality data beginning on March 24th, 2020. On March 24th, the CDC published the NVSS COVID-19 Alert Number 2 document that instructed medical examiners, coroners, and physicians to de-emphasize underlying causes of death by recording them in Part 2 of death certificates as, quote unquote, the underlying cause of death are expected to result in COVID-19 being the underlying cause of death more often than not. An incredible statement for any body to make, especially at that juncture in time. This was a major rule change for death certificate reporting from the CDC's 2003 Coroner's Handbook on Death Registration and Fetal Death Reporting and Physician's Handbook on Medical Certification of Death, which have instructed death reporting professionals nationwide to report underlying conditions in Part 1, not Part 2, in Part 1 for the previous 17 years. On April 14th, the CDC outsourced data collection rule development to the Council of State and Territorial Epidemiologists, a nonprofit entity. On April 5th, the CSTE published a position paper, Standardized Surveillance, Case Definition, and National Notification for 2019 Novel Coronavirus Disease, COVID-19, listing 5 CDC employees, including Director Robert Redfield, as subject matter experts. This key document created new rules for counting probable cases as actual cases without definitive proof of infection, and you can reference section 7A1 on pages 4 and 5 of that document. New rules for contact tracing, which allow contact tracers to practice medicine without a license. That was section 7.A3 on page 5. And yet, this document refused to define new rules for ensuring that the same person could not be counted multiple times as a new case, section 7B on page 7. By implementing these new rules exclusively for COVID-19 and without oversight for public scientific comment, the research that we found alleges that the CDC willfully compromised the accuracy and integrity of all COVID-19 case and fatality data. These acts resulted in significantly inflated data that has been used by elected officials and public health officials in conjunction with unproven projection models from the Institute for Health Metrics and Evaluation, the IHME group out of Washington University, to justify extended closures for schools, places of worship, entertainment, and small businesses, leading to unprecedented emotional and economic hardships nationwide. So that is a summary of the paper. Let me show you how you can access the paper to make your own determinations. You could click a link. We have a link in the post with this, and we will provide one if you're watching this on YouTube. We will provide one in there as well in the comments section or something to that nature so you can get access to it. And when you are looking, and click on that link, it'll take you to this page, which is housed by the Public Health Policy Journal here. Read the abstract of it here, and then you can click on this link here to launch a PDF and see the full-length version of the paper. And we do encourage you to read the entire document. We have a timeline in here of events leading back to 1980 that start to lay out the law, and the timeline continues all the way through, I do believe, August 23rd of 2020. We have over 100 citations in here, and we also outline the key elements of the law, the Information Quality Act, the Paperwork Reduction Act, and the Administrative Procedures Act to a lesser degree in this paper and to a larger degree in the subsequent grand jury petition that we'll discuss tomorrow, I think. So the paper has survived peer review. It's survived the review of over 9 different attorneys and even a judge, and it works. I think that if you've once read this and hopefully shared it with folks, if you want to do more than just be outraged on social media, which we hope you do, you can then click on the other link we've provided to the Department of Justice, where you can go to their NCDF disaster complaint form and raise your voice. So the first thing that you would do, and we'll fill this out together, is fill out the select COVID-19 from the drop box, and then you want to select healthcare fraud and also corruption by state, local, or federal officials. That's the 2 points of emphasis that we have here. Then you will fill out your name, and you can fill out as much or as little information as you want. Notice there's no red stars there. I will be supplying my email address in there as well. So we'll put one in for the school. Then when we get down to the next section on information, we want to make sure and select that it's a corporation. We want to then go down to this section here, since it is a corporation, and we want to type in the Centers for Disease Control and Prevention. And do not worry about their address. They're listed in Atlanta. Don't worry about any of that information right there. Okay. Now you're going to be asked to supply some documentation. What you're going to want to do is reference the paper here. So just copy and paste the URL into here. That's all you need to do. And that will let the Department of Justice know that you're referencing this paper. If you wanted to also put in the direct PDF one, you could. And we will do that here. Just hold down your shift key, hit enter, create a couple lines, and then paste. Go ahead and paste a line to it. So those are the 2 pieces of information you have there, which you can then state right here, describe the fraud or other internal contact. I would just say something like, please review, the URLs posted above for more detail on how the CDC violated federal law. Okay, and that will be sufficient from there. If you want to add in some more information, you can type in whatever you like. But these are the 2 key things to put in there. And then after that, you want to acknowledge that you have, do not check that you have additional documents or evidence. That's for my team to do. And then read the privacy statement and then click on submit. And now your voice is heard. And that's something that you can do literally every day for the time being. Now, my team with Operation Phoenix Rising is working on some pretty, I think, pretty cool ways for you to engage your own governance beyond just voting. Voting is incredible, don't get me wrong. But there are more ways to engage your own governance in a free country than you may have been led to believe. In the coming days, we're going to share with you information on how to engage your specific U.S. attorney. We've collected all the information. We're going to help you find them so that you can engage not only the Department of Justice, but also your U.S. attorney in helping to apply some pressure and demanding a grand jury investigation into what we have found, if you agree with what we have found. In the coming days, we are also going to show you how to engage your state medical board, as well as engage your board of education for your state, so that you can make your voice heard with them, particularly if your children are still, for some inexplicable reason, not able to attend school in person, which is a very big deal to me. So with all that being said, On behalf of everyone on the COVID research team that has authored the paper, on behalf of everyone with Operation Phoenix Rising that has been volunteering our time and efforts all year, completely free of charge, as we should. This is a duty call. This isn't something that we're supposed to be doing for gain. On behalf of everyone, we are excited to have you read the paper. We are excited to get feedback from you on the paper if you want to share that with you, but more importantly, if you agree with what we have put together for you, and there is more to come, we encourage you to do two things. Number one, right now, contact the Department of Justice and fill out that form and do it every day. Okay, let's make sure we're heard. And number two, share this information with at least 3 people every day and encourage them to do the same. Our goal is to get millions of Americans filling out these forms and putting so much pressure on the Department of Justice and our U.S. attorneys that we can find the ones who are duty bound as we are, and that we can together call for and aid them in their efforts to launch a formal grand jury investigation into what we consider to be the greatest example of corruption in our time. Thank you so much. On behalf of everybody that I've been so lucky to work with, I just want to say thank you for reading what we've put together, and we hope it makes a difference in your lives and in your children's lives. Mahalo.